All right. So, hi everybody. Name is Ryan Spalding. Uh, I'm a little bundled up. I just got off of shift, but I'm here to talk to you guys about a intraosseous infusion, or what's known as EZIO. Very simple, straight to the forward. I've always had an interest in medicine, and a lot of the things that are coming out these days are uh, on the cutting edge. This procedure is one of them. Um, So to start off with, I'm going to go ahead and say the reason that this procedure, because it is a medical procedure, exists is because a lot of times there's patients or people who get into critical situations and it turns out that they need fluids, blood, medications in a very fast way. And sometimes getting an IV, through your vein isn't always an option. Uh, so scientists and medical professionals, doctors have come up with something called the interosseous infusion site. So, what it is if you follow down to your knee and you take your two fingers, your index finger and your middle finger, and place that right underneath where you feel a bump on your knee, that part of your knee is called the tibial tuberosity. If you go about 1.5 inches to the left towards the center of your leg, immediately, like towards the center of your body, that's the site of the bone where a large needle gets inserted with a drill in order to access your bone marrow. Once it is in that bone marrow, um, we take a saline flush and you slam it, and that creates all that space in there for fluid and medication to go in after you've secured it and everything. I'll go into detail later. So, yeah, this procedure exists to begin with because research has shown that in a trauma or in critical conditions, fluid needs to be administered fast, and looking for a vein isn't always the fastest and easiest way to do it. So, they decided to go through the bone marrow, and then that fluid or that medication will find its way to the central system and get just flushed out throughout your venous system. Um, some indications or some reasons as to why you might give it or why you might do this procedure um, are if somebody is dying, if someone needs fluids rapidly, um, if someone is amputated in their arms and they can't get medications any other way but through their bone marrow in their leg. It's a quick way to just make sure that your patient stays alive with you um, until further care can be given. And those are some indications why. There are some contraindications or some reasons not to give it. If somebody has any kind of bone cancer, any kind of problems with their bones, you probably don't want to give this to them just because the success rate might not be as high as somebody who is otherwise healthy in that department. Um, On to the next subject, how to successfully perform one. Now, with me, I have a nationally registered standardized list of procedures that I've included in the presentation aid and steps of how to successfully complete one. One of the first things you always want to do if you're going to ever get invasive and intraosseous into somebody's body, you want to make sure that you have the proper protective equipment. So that includes gloves, goggles, face masks, whatever to keep yourself safe and the patient safe in case you're carrying something that might harm them. Excuse me. After that, you want to make sure you have the proper equipment. Nowadays, the equipment comes with a little automatic drill. So a little red handheld drill, and before you even start your day, you want to go ahead and give that a squeeze to make sure that it goes. In that little drill or in the packet where the drill comes in, you have two different size needles. There's a pediatric size, little smaller, thinner needle, and an adult size, which is a little longer and the diameter is wider. Along with that comes your flush and some little gauze or tape to secure it once it's been administered. Once you've got all your equipment with you, what you want to do next is you want to find what's called the administration site. So that site is going to be where you want to put it. Now, the military has many options when it comes to these types of procedures because we learn a lot from medicine from them. But as far as the civilians are concerned, the main place that this gets placed is where I call the tuberosity and an inch or an inch and a half to the left of that if it's your right knee and to the right of that if it's your left knee. After you've selected the appropriate site, what you want to do next is go ahead and clean it off with the alcohol prep. Make sure it's nice and sterile, as sterile as can be. Then you're going to take your drill. You're going to find the appropriate size needle, whether if it's for a pediatric or for an adult. You're going to attach that to the drill. Once you've done that, you're going to go ahead and line it up 90 degrees to that site that I was talking about. 90 degrees, and then you're going to push until you feel resistance. Once you feel resistance, that means that your needle or the tip of your needle has now made contact with the bone. You're going to give it a drill, and you're going to keep drilling until you feel a give. It's almost as if you're drilling a hole through wood. Once you feel that give, you stop drilling, you disconnect the drill from the needle. Now you attach a syringe or a saline flush is what we call it to the needle, to the hub of the needle, and you flush that really quick, and that flushes all that bone marrow out the way. Then you get your fluids, whether it be normal saline or blood or medication, and you go ahead and put it through there, and now you have intraosseous infusion. The beauty of that is that it gets through your system quicker. The success rate is pretty high. Unlike finding a vein where veins roll on you and you have to think about how fragile their skin is, I always stay put until you take them out, and they're pretty hard to get out, so it is a permanent fixture. Other than that, it's like I said, it's an amazing procedure, and I hope you guys got away with some new information about emergency medicine.